My name is Dr. Hopp, Robert Hopp. I'm a dermatologist here in Kennewick, Washington at the Center for Excellence in Dermatology. And I've created a video list of informational videos for my patients, covering subjects all the way from shave biopsies to melanoma to sunscreens and everything in between. They're short, informational videos of what I tell my patients, and their instructional drawings that I've included that I think help patients understand uh, the subject that's being talked about. So I would encourage you to take advantage of these.
This video is on redness around the surgery site after excision. So after excision of the wound and closure, anywhere from immediately post-op to several days after the excision, redness can develop around the wound. And it's important to evaluate the cause of that. There are several different causes. And this usually presents as swelling and elevation of the skin, some edema, and redness. There are two primary sources for the redness. One is allergy to adhesive in the Band-Aids, or to the topical antibiotic. And that would be polysporin or mupirocin, typically. There are certainly other ones that can be used. So if those are the cause of the redness and the itching, typically the symptoms are not painful. There's no tenderness when you touch the wound. There's only a sensation of itching and a compelling need to scratch the wound. But there's no tenderness when you touch it. It doesn't hurt. And there's no discharge from the wound. The treatment for the allergy is to discontinue whatever is causing the rash. So usually with an adhesive allergy, what you'll see is a surgical site, and then there'll be sparing around the wound where there was cotton next to the wound, and the redness will correspond in almost a square to where the adhesive was in contact with the skin. So typically with adhesive allergy from the Band-Aid, the rash is away from the wound with some sparing from the cotton being around the actual surgery site. Adhesives and Band-Aids are not listed on the packaging, and only by trial and error can you determine which ones of the adhesives you can use and which ones you can't. A good bet is paper tape in the short run, which is very rare to see people break out to with an adhesive allergy. With the antibiotic allergy to polysporin or mupirocin, you can switch to a different antibiotic or just use plain Vaseline. Plain Vaseline will keep the wound, the dressing from sticking to the wound, and it's impossible to be allergic to that. So allergy to adhesives or antibiotics are one particular cause. The second cause is infection. An infection usually will take place about 2 to 3 days after the excision, and there'll be redness immediately around the wound. And with infection, the wound is painful. So it's not itchy, but there's usually pain, and that can be anywhere from burning and stinging to throbbing and tenderness when you touch the wound. Sometimes there's some oozing of a clear fluid or pus from the wound. Oftentimes just one part of the wound is red and swollen compared to the rest of the wound. And that would typically be from a bacteria. Most common bacteria is staph. And if that's the case, generally a topical antibiotic can be used if it's very mild, but more often an oral antibiotic is used for a period of 7 to 10 days after the sutures are placed, and occasionally one has to open the wound to allow it to drain. Open the wound and drain. That's only done in the most severe cases. So infection, as opposed to allergy, is painful. Patients don't want to move the area. If it gets bumped or bruised, it's tender and painful. It's swollen above the skin, and sometimes there's some discharge. So infection is very important to treat. One can take a culture of the wound to determine the bacteria and then start on typically an oral and topical antibiotic.